my name is Lori Stankovich, and this is my 612 physical assessment. And this is my husband, Gabby. He has agreed to be my patient. Before we came in, I had Gabby empty his bladder and change into some comfortable clothes. If this was in the physician's office, it would be skin to skin. We completed a far vision test with the Snellen chart and a near vision test with the Rosenbaum chart. And that was assessing for cranial nerve 2. I'm going to inspect his head and face. His head is normal cephalic. His face is uniform in color. His eyes are symmetrical. His ears are symmetrical. And his nose and mouth are midline. I'm going to come up and assess his 7th cranial nerve and have him do a series of tests. I'm going to have him wrinkle his forehead, clench his eyes, clench his mouth, puff his cheeks, stick out his tongue, and smile. Okay. Then I'm going to come up to his scalp and assess his scalp. Make sure it is without any lesions or indentations. I'm going to check his hair and make sure it's smooth, which it is. I'm going to make sure his hair is evenly distributed on his head. I'm going to then come down and palpate his face. I'm going to palpate for pain, make sure that it's symmetrical. I am going to palpate his frontal sinuses and his maxillary sinuses. I'm going to check his jaw for TMJ, have him open and close his mouth, and check for any popping or clicking. I'm then going to come up and check this light sensation, that is cranial nerve 5, to his face. So let me know if you feel this in your cheeks and your chin. Then I'm going to come up and assess his eyes. I'm going to assess his eyelashes and eyebrows. His hair should extend to his inner canthus and extend across his eyebrows. His eyelashes are thick. He has no eyelid abnormalities that I can see. His eyelashes swoop out. His eyes close completely. He has the lacrimal glands are intact and they are not abnormal. I'm going to have him open his eyes so I can look at his conjunctiva, make sure that that's pink and moist, and his sclera is white. I am then going to do a series of eye tests that will check cranial nerves 3, 4, and 6. I'm going to do a cover-uncover test. So cover, uncover, cover, uncover. I am then going to check his extraocular movements. I'm going to have him look at my pen light and follow it, keeping his head still, making sure his eyes transition smoothly, and there is no nystagmus. I'm then going to check his peripheral vision with the confrontation test. Let me know when you can see my fingers. Okay. Now I'm going to check his pupils. I'm going to do direct, consensual, direct, consensual. Okay, now that I'm done with his eyes, I'm going to go ahead and check his ears. I'm going to look for his ears are evenly aligned. I'm then going to palpate his auricle for any nodules or any type of pain. I am going to, you have no pain. Then I'm going to look in his ears with my otoscope, and I'm going to look for the gray tympanic membrane and the cone of light and make sure that the canal is clear, and I will do that bilaterally. I'm then going to have him put a finger in his ear. First I'm going to check the ring test. I'm going to take the tuning fork and hit it, and then put it on his mastoid bone. Tell me when the ringing stops. Tell me when the ringing stops. Air conduction should be twice as long as bone conduction. I'm then going to do the whisper test, which will check cranial nerve 8. I'm going to have him put a finger in his ear. I'm going to step over here and say 3 words that he will repeat. I'm going to come over to on the other side and do the same and have him put his finger in that ear.
Red, blue, yellow.
Okay. All right. So that concludes the ear test. I'm then going to move to the nose. I'm going to look at the structure of the nose. I'm going to look at the nasal septum, should be midline. I'm going to look inside the nose and look at the turbinates, make sure that they're pink and moist and the hair is evenly distributed. I'm then going to have him check nasal patency, so I'm going to have him occlude a nostril and blow out on both sides, please. Then I'm going to check cranial nerve 1, the olfactory. I'm going to have you close your eyes, and I'm going to give you a scent and let me know what this scent is.
Lemon.
Okay. And then just let me know what this scent is.
Coffee.
Okay. Now I'm finished with the nose. I'm going to move to the mouth. I'm going to inspect the lips for any fissures or lesions, which he does not have. They look smooth and normal. I'm going to then have you open your mouth so I can look in your mouth. I'm going to look at the color, which is pink. I'm going to look at the buccal mucosa, the hard and soft palate, the posterior and oropharynx. I'm going to look at the tonsils. I'm going to look at the uvula, the floor of the mouth, and the gums. I'm going to look at the teeth. There should be 32 teeth. The characteristics of the teeth, make sure that they're white, that there's no tooth pain or missing teeth. I'm going to also look at the tongue. I'm going to look under the tongue, on the sides of the tongue, make sure there's no tongue lesions or tongue cancer. I'm going to look at the symmetry of the tongue. I'm going to make sure the tongue is strong, and that would check cranial nerve 12. I'm then going to have him swallow, and then I'm going to check his gag reflex, and then that checks cranial nerve 9 and 10. And then we're done with the mouth. So now I'm going to check the lymph nodes, assess the lymph nodes. So I'm going to assess the pre-auricular, the post-auricular, the pre-auricular, the post-auricular, the occipital, the tonsillar, the submandible, the submental, the posterior cervical, the anterior cervical, and the deep cervical. I'm going to assess the supraclavicular, the infraclavicular, and the axillary. Good. Now, when I'm done with the lymph nodes, I'm then going to look at the neck. I'm going to look at, for the smoothness, the symmetry of the neck. It all looks normal. I'm going to go ahead and palpate the trachea and the thyroid. I'm going to go ahead and palpate the carotids bilaterally. They should be +2. It's good. I'm going to go ahead and listen. And I'm going to listen to the carotids one at a time with my stethoscope. Good. And I'm going to listen to the thyroid. Okay. And then when I'm done with that, I'm going to go ahead and have him do a series of neck movements. So I'm going to have him extend, flex, side to side, and then against resistance, here and back. Good. And side to side. Okay. And then go ahead and shrug your shoulders. And that's cranial nerve 11. Okay, and so when I'm done with that, I'm going to go ahead and look at his chest. I'm going to look at the respiratory effort, the respirations, make sure it's symmetrical, make sure his movement is symmetrical after I inspecting his chest. So then after I inspect, I'm going to go ahead and palpate. So I'm going to press all the way down. Then I'm going to do tactile fremitus 99. 99, 99, 99. Now I'm going to check his precordium, his chest, and his point of maximal impulse, and I'm going to check for any heaves, lifts, or pulsations. I'm going to then percuss, side to side, symmetrically comparing, all the way down, under his arms. Okay. Then I'm going to go ahead and auscultate his chest. Take some deep breaths, in and out. Gonna auscultate side to side, comparing. His lungs sound nice and clear. And I'm gonna check laterally. Good. Okay, now I'm going to go ahead and auscultate his heart. I'm going to auscultate the aorta, pulmonic, second pulmonic, tricuspid, and the mitral valve, mitral area. Okay, good. Okay, so I'm going to have you turn around, and I'm going to check your back. I'm going to look for the color, the respiratory effort, the respirations, the symmetry, and inspect that. So I inspected that, so I'm going to go ahead and palpate all the way down. I'm going to do tactile fremitus, so 99.
99.
Okay, so, and then after that, I'm going to go ahead and percuss all the way down. Side to side. I'm going to, when I get down to the costovertebral angle, I'm going to go ahead and apply indirect pressure, and that should not elicit pain for the kidneys. Okay? Then I'm going to check for chest excursion, so I'm going to have you just take a deep breath, and my hands should go up symmetrically, move up and down symmetrically, and let it, go ahead and let it out. Good. Now I'm going to check for diaphragmatic excursion. So I'm going to have you take a deep breath. I'm going to percuss down to dull, mark, go ahead and breathe. Now I'm going to have you take a couple breaths and exhale. Okay. Then I'm going to percuss up from that mark to residence and mark, and that should be 3 to 6 centimeters. Okay, you can breathe. Okay. And then when I'm done with that, I'm going to go ahead and auscultate the back. Take some deep breaths. I'm going to go side to side. Nice and clear. They sound nice and clear. And laterally. Good. Okay. Can you please go ahead and lay down? And I'm going to check your abdomen. So I'm going to go ahead and pull his shirt up so I can assess his abdomen. First I'm going to inspect. So I'm going to inspect for the contour. I'm going to look for any pulsations or any movements, which I do not see. And the color looks good. I'm then going to go ahead and auscultate. I'm going to auscultate all 4 quadrants. And if I do not hear any vowel sounds, I'll listen for 2 to 5 minutes. I'm also going to auscultate the arteries, so the aortic, the renal, the iliac, and the femoral. Okay, when I'm done auscultating, I'm going to go ahead and percuss. So I'm going to percuss over the abdomen. I mostly hear tympanic sounds, so could hear some dull, depending. I'm going to percuss the liver border, so I'm going to move from timpani to dull and mark. Then I'm going to move from resonance to dull and mark, and that should be usually 6 to 12 centimeters. I'll go ahead and do the same on the side of the spleen, on the left side. Okay, so went ahead and percussed. I am then going to lightly palpate the abdomen. Get them used to my fingers, tips, feeling for any masses. I will then deeply palpate the abdomen for any pain, masses. I'm going to palpate the liver border, and I'm going to palpate the spleen area, although you should not feel the spleen. Okay, and then when I'm done palpating, I'm going to go ahead and check for aortic pulsation, which he does not have. I'm going to go ahead and have him lift his head, and I'll look at check his abdominal muscles. Go ahead. Then I'm going to check his kidneys. I'm going to palpate for his kidneys. Okay. And then I'm going to have you go ahead and sit up and face me, please. So I'm going to assess his upper and lower extremities. I'm going to assess them for temperature, color, and hair distribution. And it all looks good. Temperature is good. I'm inspecting. Everything looks good. I'm then going to palpate for the muscle mass, and that looks good. I'm going to then have him put his arms out. I'm going to push down and up, and then straight, push down and push up. Okay, you can relax. Now I'm going to go ahead and palpate his pulses. So I'm going to palpate his brachial, his radial, his popliteal, his dorsalis pedis, and his posterior tibial. I'm going to then look at his fingers, check for cap refill or any edema and any clubbing. Can you go like this? Yeah. No clubbing. Okay. And I'm going to check his feet for edema and cap refill. I'm also going to have him pull up and push down. Good. Good. Now I'm going to go ahead and check his reflexes. So I'm going to check his his brachial, his radial, his patellar, good, good, and his Achilles, good. Okay, I am then going to check him for, make sure I'm going to check for soft and sharp. So check his sensations. So let me know if is this sharp?
Sharp.
Yeah.
Sharp. 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 Sharp.
And this is this dull?
Dull. 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 Dull.
Good. Okay. So I'm going to go ahead and have you stand up. I'm going to have you face the camera. I'm going to check you for your cervical spine alignment, your thoracic and your lumbar spine alignment looks good. I'm going to go ahead and have you bend over. And I'm going to check you for kyphosis and lordosis and scoliosis, and that all looks fine. And that's it. And that concludes my 612 physical assessment.